Yo, this is Doc P. Sorry that I am not doing a live this week, but I just wanted to talk about a topic that's kind of really frustrating me just a little bit. And this topic really is more of a teaching point for the public, anybody that's not in medicine, to understand like the training and what people know, because I hear a lot of things and misconceptions about doctors, residents, fellows, medical students, about like who knows what and what they go through and all of those types of things. So let's be very clear. All right, if you see someone that's in medical school or somebody that just graduated medical school, understand that you're looking at probably the top 5 to 10% of intelligence in the world. All right. The thing that you have to do to get into medical school, all right, so the admissions testing, which is the MCAT, and then step 1, step 2, step 3. Step 1, that first board examination to become a physician, is the hardest. I will go on a branch and say it is the hardest test there is known to man. Period. There's no test. I really would challenge anybody to try to refute that. This is the hardest test that any person will ever take in their life. And medical students take this in their first 2 years of medical school. So if you see somebody that's gotten through medical school, or even after the first 2 years, after that test, that's a smart person. That person has been through 4 years of undergrad and then a minimum 2 years of medical school. So when you talk about, oh, he's just a medical student and what have you, these are some very brilliant, smart people. All right. Every medical doctor, whether it's an MD or a DO, so there's an osteopathic and allopathic pathway to become a physician. Both of them are very similar. They go through 4 years of medical school, but they differ just a little bit. And the nuances of their differences is not important, but just understand that it's a 4 years of rigorous like training and learning every single thing about the body, right? So if you see somebody with an MD or DO behind their name, put some respect on their name, all right? Please believe that they don't do just one thing. They understand a lot of things. Are there some doctors out there that are floating it that, are kind of awful, what have you? Yes, but don't get it twisted. MDDOs, they have been through the rigor. So when you go to a hospital and you say like a medical student is going through it, but once you get through medical school, you are a doctor. All right. So, I hear a lot when people say like, oh, he's not a real doctor. Once you graduate through medical school, once you finish those 4 years, you get an MD. All right. So that would be that one over there. So no, excuse me, my bad, wrong one. That's residency. So that one right there, U of I, that's my medical degree. When I graduated from medical school, I got that. All right. So anytime somebody has one of those, they're pretty damn smart. So don't just take a medical student and somebody's graduated medical school, not a real doctor. Once you finish medical school, you are a real doctor, period. Now, what happens after medical school is that people go into training. All right. So for me, I'm an OBGYN. So I have to go through 4 years of training to learn everything about my field. And I've said this in a previous post before. OBGYN doesn't just deliver babies. Okay. Like I can teach anybody how to do a simple normal vaginal delivery. All right. That's just the obstetric part. All right. When it comes down to like, somebody said, well, like, what's the difference between you and a midwife? Or like, can like midwives or what have you do it? Like, listen, they pay me from the obstetric side and OBGYNs from the obstetric side. The 2 out of 10 times when things go all the way wrong, all right? Preeclampsia, placental abruption, emergency C-sections, fetal distress, preeclampsia. All of these things are things that when the stuff hits the fan, that's what we go and we train and go through medical school. That's 8 years of training, right? During that 8 years of training, we learn multitudes of things. It's not like you just learn about being an OB and that's it. You learn about everything. So in medical school, you go through surgery, you go through pediatrics, you go through family practice, you go through emergency medicine, you go through through psychiatry, right? Even before you get to those rotations, you have to learn everything about medicine. So those first 2 years is just straight book memorization, understanding anatomy, understanding physiology, understanding pathophysiology, understanding all that stuff. Then the next 2 years are just applying it to each particular field. So as an OBGYN, I have to know something about every single field. Now, when it gets into the true specifics of it, yeah, then that's why you have specialists. But as far as any doctor, family practitioner, psychiatrist, emergency medicine, orthopedic, you name it, all of these doctors have a global knowledge about every single specialty. They are just specialists in their particular fields. So I want people to understand that, because if I hear one more time, like, oh yeah, you just deliver babies, you don't know about, come on, man. Like, seriously, I spent put some respect on it. Like, put some respect on medical students, put some respect on residents, put some respect on fellows. Like, we don't just learn a particular thing. We spend hours. I sacrificed my entire 20s to learn every single thing, right? And then my 30s to get very good at one particular thing. So please understand that. Like don't do that. Like have some respect for people. Like, I know I joke, I know I kid, and I know I may not look like a doctor or what have you, but like, don't get it twisted. Like, if you've been here and you understand what's going on, like, trust me, like, everybody is knowledgeable when it comes to that. Like, you're global. You should have global knowledge about everything. So if I'm on a plane, or if there's a doctor on a plane, it's a reason why somebody has it. It's not like, oh, is there a surgeon? Oh, is there a doctor? Because a doctor has the general knowledge to keep somebody alive, or to understand what's going on in the body with seizures, with strokes, with heart attacks, or whatever. We all understand how to keep somebody alive, understand what's happening to treat that person. So put some respect on it. Like, that's been my thing for today. Like, understand, like, that physicians have to go through a lot to get to be board certified or what have you, but they have global knowledge. It's just not all compartmentalized. And put some respect on OBGYNs too, like, because don't consider me as somebody just deliver babies. Like, in my private practice now, I don't even do obstetrics anymore. I'm gynecology. And the gynecologic aspect of OBGYN, that's surgeries, that's dealing with, sick women and things that affect women. I'm the first line of treatment and care for women. All the things that go on, fibroids, endometriosis, all those things that happen to women. And it has nothing to do with the obstetrics or delivering babies part. So that's that spill. I don't put anything, or I won't speak bad about, mid-levels or mid-level practitioners or nurses or anything, because we're all important. We all work as a cohesive unit to give patients their adequate care and to treat patients holistically. Like, there are things in nursing that I can't do. I just didn't learn how to do that. And there's many things that nurses that they have not trained, to do the things that I do. But it's a respect level, because I can't treat my patients. I can't do the thing. I can't holistically treat my patients without, ancillary staff, without mid-level practitioners. Like, everybody is important. But at the end of the day, don't get it twisted. Like, physicians have sacrificed. They have global knowledge. Give them the respect that they deserve. I hope you all have I hope you had a very Merry Christmas, and I hope you have a wonderful and prosperous new year. Big things to come in 2020. And I hope that, you know, everybody has big plans and big ambitions and big dreams. Some things that happened to me in 2019 that I'm going to let out of the bag. I got some vendettas and things that I need to address. So stay tuned, and keep watching your boy. Like I said, every Monday we'll be back, next Monday, you know, kicking off the lives, and I'll have a better topic for everybody to come in and chime in and ask questions. I'll make it so that, you know, it's inclusive for everybody and it's much more interesting. But I had to get this off my chest because, you know, I have even somebody in my own family try to play me, or not play me, but kind of play me behind my back, basically saying like, oh yeah, he doesn't know much. He just delivers babies. Like, what? Put some respect on me. Please put respect on my name. Like, because when it go down and they really need something, or they really need to have a conversation about what's going on, then you're going to ask. Like, doctors are doctors. Doctors know things. Like, realize, and medical students know things. Residents know things. I was a resident for 4 years after medical student. After a medical student, residents are doctors. Residents are real doctors. They have 4 years of medical school. They are doctor whoever, right? There's training now to do whatever they are specifically trying to do, whether it be OBGYN, whether it be orthopedic surgery, whether it be plastic surgery, whether it be psychiatry. They're training, but the global knowledge of being a doctor, they've already got that. All right. Fellows, or when you do a fellowship, that means you've done residency, and now you get even more training to get more specific. So maternal fetal medicine is a prime example for OBGYNs, where you do your 4 years of OBGYN and you do another 3 years to handle all of the problems, like the high risk, complicated problems of obstetrics. But even with that being said, end of the year fellow or fellow, they have global knowledge. So I just wanted to say that to break down definitions so people understand, you know, what physicians are, who knows what, like, you know, and just to have an understanding that, you know, they're knowledgeable. And if they're nice, they should share that knowledge with you. God bless. Talk to you guys next week. All right.